Most healthcare AI is not reducing your team's workload. It's just moving it around. If you're building or buying healthcare AI, listen up. Your nurses aren't drowning in paperwork anymore. They're drowning in AI-generated alerts. Your care coordinators aren't manually tracking patients. They're manually reviewing AI flags. And nobody's talking about this. Healthcare leaders are finally saying out loud what we've been seeing behind the scenes. AI needs to stop generating insights and help us start taking action. So in this video, I'm going to show you why your time-saving AI might be making clinical teams more overwhelmed, the one question every health tech exec should ask before building AI features, and what true work deletion looks like versus just work transfer. Let's go. Say a hospital is buying an AI tool that promises to automate patient triage or predict readmissions or identify high-risk patients. And technically it does all of that because the AI analyzes thousands of data points and processes EHR information and generates insights. But here's the catch. Somebody still has to look at those insights. Someone has to review the AI's recommendations. Someone has to decide if the AI got it right, and somebody has to take action on the AI's alerts. So we didn't delete work by using AI. We just moved it from manually analyzing patient data to manually reviewing AI outputs. It's the same burden on a different screen. And often it's actually more work because now you're dealing with false positives, alert fatigue, and trying to figure out why the AI flagged something. So what do you think happens when you multiply this across a whole health system? Another hidden cost that nobody talks about is the training burden. Every new AI tool requires your clinical staff to learn a new interface, understand new terminology, and memorize new workflows. And that's hours of training time that takes them away from patient care. So not only did you transfer the work from manual analysis to AI review, you also added learn how to use the AI on their plate. After thousands of hours of training, that's expensive disruption. Let's say your AI identifies 50 high-risk patients per day that need follow-up. That sounds manageable, right? Not until you factor in that you've got 10 care coordinators, so that becomes 500 patient flags per day your team needs to review. Research shows that clinicians have to override between 49 to 96% of drug alerts. That's just the medication alert. When you add AI-generated risk predictions, care coordination flags, and documentation reminders, that override rate climbs even higher because providers simply don't have time to process that kind of volume. This is what I call decision debt. Every AI-generated insight creates a decision that someone has to make. And unlike financial debt, you cannot ignore decision debt. It piles up in your team's cognitive load because your care coordinators stop trusting the AI when it cries wolf too often, your nurses develop alert fatigue and start clicking through without reading, and your physicians get frustrated because now they have to justify why they didn't follow the AI's recommendation in their documentation. If that's not bad enough, what's really frustrating is the AI itself might be clinically inaccurate. Clinicians overriding half to almost all the alerts received means that accuracy doesn't matter. The workflow design matters, and so does the trust and the cognitive load. You can have the smartest AI in the world, but if it's dumping 500 decisions a day to an already overwhelmed clinical team, it's gonna fail. And that's not all. Your expensive AI tool gets abandoned, or worse, it gets used just enough to create busy work, but not enough to actually improve outcomes. I've seen RPM platforms that struggle with this. They add sophisticated AI features thinking it'll help their customers, but then hospitals complain about low adoption rates. The AI is smart, but it created more work than it got rid of. And then there's another layer to this problem, not done yet. Many AI tools operate as black boxes. The AI flags a patient as high risk, but it doesn't clearly explain why or what specific factors drove that prediction. So now your care coordinator has to become a detective. They got to dig through the patient's chart to figure out what the AI saw. And this turns what should be a time-saving tool into a time-consuming puzzle. And when clinicians can't understand the AI's reasoning, they stop trusting it. The trust is destroyed, and that means your adoption rates tank too. Now here's the question that every health tech exec should ask. Does this cut our work down or just move it around? Be brutally honest. If your AI feature generates a report that someone has to read and act on, that's work transfer. If your AI identifies risks, but it requires a human to review and follow up, that's a work transfer too. And if your AI creates alerts that need to be triaged, same thing. True work deletion looks different. It looks like an AI that identifies patients who missed medications, and it sends them a personalized refill reminder and schedules the pharmacy delivery. It looks like an AI that flags documentation gaps and auto-populates the missing information from previous notes. And it could also look like an AI that predicts the risk of readmission and automatically triggers the appropriate care protocol without requiring somebody to review and approve it first. The difference is action versus insight. Insights create more work. Automated actions remove it. And I'm not the only one that's saying this. Health tech leaders are pushing for AI that moves from prediction to action instead of just generating more data points for humans to process. And yes, I know what you're thinking. There's regulatory issues, liability concerns, and clinical judgment requirements. That's absolutely true. But that means you need to design your AI to handle those constraints up front, not dump them onto your already overwhelmed clinical users. And here's a bonus question that you should ask about liability. If the AI recommends something and you don't follow it, are you liable? If you do follow it and something goes wrong, who's responsible? These are not theoretical concerns, y'all. They're keeping health system executives up at night. When your AI creates recommendations that require humans to make judgment calls about following or overriding them, you're not just transferring work, you're transferring risk and liability too. Work deletion AI, on the other hand, operates within pre-approved clinical protocols where the liability framework is already established. That's the difference between a tool that creates anxiety and a tool that creates confidence. Healthcare executives specifically want AI that integrates seamlessly into clinical workflows without adding new steps. Let's say you're using an RPM platform that monitors patients with CHF, congestive heart failure. A traditional AI approach would flag when a patient's weight increases by more than 3 pounds, indicating potential fluid retention, and send an alert to the care coordinator. The care coordinator then has to review the alert, check if it's a real issue or a scale error, and then decide if intervention is needed, and then make outreach. Now let's flip that scenario. The AI detects the weight increase and cross-references it with the patient's other vitals, medication adherence, and recent clinical notes. If the pattern matches fluid retention, the AI automatically sends the patient a message with specific questions about symptoms. Based on the patient's responses, the AI either schedules a same-day call with the care coordinator for high risk, adjusts the patient's diuretic dosage within pre-approved parameters, or sends education about fluid management for low-risk responses. In that scenario, the care coordinator only gets involved for the cases that truly need clinical judgment. So it's maybe 20% instead of 100%. That is a huge reduction in manual work. Not because we removed humans from the equation, but because we designed the AI to handle the routine decisions and escalate the complex ones. This addresses multiple concerns that healthcare leaders have. It integrates into existing workflows without requiring new steps. It provides transparency about why these actions are being taken. It operates within pre-approved protocols, so the liability risk is clear. And it doesn't require care coordinators to learn a complex new system because the AI works in the background. And that is what seamless integration looks like. The care coordinator isn't spending their time reviewing 50 alerts a day. They're having those 10 meaningful interventions with those high-risk patients who need it now. So if cutting down your work with AI is so obvious, why aren't founders building it? It's a fair question. The truth is, it's harder. AI that deletes work requires deeper EHR integrations, more sophisticated decision logic, navigation of regulatory frameworks, and collaboration with clinical teams to define safe automation boundaries. It's a lot easier to build an AI that generates a report or an alert than one that takes action. But healthcare leaders don't just want easier, they want better. They want AI that respects their time, their expertise, and actually solves the problems they face. Health tech companies that are willing to do that hard work of making work deletion AI to cut work down will earn more trust and drive more adoption to win in this market. If you're a health tech founder or a product design leader, you might be thinking, that sounds great, but this is harder to build and harder to sell. And I know, you're right. Work deletion AI requires more sophisticated design, tighter integrations, and often regulatory navigation. But here's the business case. Your buyers are tired and burned out. Healthcare workers are literally reporting that AI tools are increasing their workload instead of reducing it. Healthcare organizations are experiencing what experts call innovation fatigue. They've implemented 5, 6, or 7 new technologies in the past 2 or 3 years, and every single one of them promised to save them time, but increase their team's workload instead. So it's understandable why these folks are skeptical. They're over shiny tools that require them to change their workflows, and they're looking for solutions that actually reduce their burden, not just digitize it. So when you can prove that your AI solution removes work instead of adding more work, you're not selling software. You're selling relief. That's a completely different value proposition, and it commands premium pricing because it delivers tangible ROI in the form of time savings and reduced burnout. What do you have to gain? Your retention rates will get dramatically higher, and you'll have products that really reduce work become mission critical, and products that create more work will get abandoned at renewal time. Drop a comment and tell me, what's one AI feature in your health tech stack that you thought would save time, but it actually created more work? Let's talk about it. I'd love to hear from you. Thanks for watching this video, and now watch one of these next.